Okay, today we are going to discuss about tongue. First I will orient you with the specimen. This is the tongue, you can see the section of the tongue. This is the hard palate, this is the soft palate, you can actually see the part of your nasal septum also. This is the section of mandible, and you can see the major bulk of the tongue is made up of muscles itself. Okay, you can see the tip of the tongue, the body and the root where it is attached to the hyoid bone, which is not present in the specimen unfortunately, and you can see it is attached to the mandible also. You can see the surfaces, this is the dorsal surface, this is the ventral surface. To the ventral surface there is a connection called as frenulum linguae, and you can see the dorsal veins of the tongue also here. Okay. We will continue our discussion in this specimen. You can see the body of the tongue, the tip of the tongue and the root, and it is completely detached along with the larynx, okay, and part of your pharynx. Okay. So, this is the tip, body and the root of the tongue. Okay. So, the surface of the tongue is divided into two parts by a sulcus terminalis, a V-shaped sulcus present on the posterior aspect of the towards the posterior aspect of your tongue. It is marked by a central foramen cecum, which you might remember from the development of your thyroid gland. Okay, just in front of this sulcus terminalis, you can see circular circumvallate papillae arranged in a V shape. We have fungiform papillae, filiform papillae and a little bit of foliate type of papillae. The fungiform type of papillae is generally seen in the towards the tip and sides of your tongue. They also carry a taste bud in their surface, whereas the filiform papillae is mainly present in the center part of the tongue, and its main function is just to propel the food posteriorly. So, it is just there to produce more friction between the tongue and the food bolus. Like I mentioned, the tongue is a muscular organ. The muscles of the tongue is classified into mainly two groups, extrinsic and intrinsic group. Intrinsic group muscles are confined into the structure of the tongue itself, whereas the extrinsic muscles are attached from the tongue to an external bony landmark. Intrinsic muscles include superior, inferior, vertical and horizontal sets, whereas the extrinsic muscles include genioglossus, styloglossus, palatoglossus, etc. From the name itself, you know that genioglossus is taking origin from genial tubercle in your mandible, and styloglossus is taking origin from the styloid process and it is attached to the sides of your tongue. Likewise, hyoglossus is taking origin from the hyoid bone and it is attached to the sides of your tongue, so on and so forth. The basic difference in action between these two, the intrinsic muscles are just going to change the shape of the tongue, okay, just the surface and the shape of the tongue, whereas the extrinsic muscles are more concerned with the motions of the tongue. Like when you are speaking, you have to move your tongue around, right. So, that part is usually by the extrinsic group of muscles. Now, coming to the features of the tongue again, as you know, you have a tip, you have the sulcus terminalis. Behind the sulcus terminalis, this part is known as the posterior part of the tongue. It is, as you can see, the surface is laden with lymphoid aggregations. This is all these together will form the lingual tonsil. Okay, it is seen behind the sulcus terminalis. The area in front of the sulcus terminalis is anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue, and you have a posterior most part of the tongue also. That is more seen in close relation with the valleculae, which are these depressions seen on the posterior most part of your tongue. Now, coming to the nerve supply of these muscles that I mentioned earlier. All the muscles of the tongue are motor supply for all the muscles of the tongue are supplied by the hypoglossal nerve, except the palatoglossal muscle, which is supplied by the cranial root of accessory nerve via pharyngeal plexus. Okay. The general and special sensation from the anterior two-thirds of the tongue are carried by different nerves. General sensations are carried by the lingual nerve, whereas the special sensations from this area is carried by the chorda tympani, that is mainly the taste sensation. Okay. Then the posterior most, not the posterior most, the posterior two-thirds of the tongue, the general sensation as well as the special sensations are carried by the glossopharyngeal nerve. To show you a couple of muscles that we described earlier, the big fan shaped muscle that you can see here is the genioglossus. It is otherwise known as the safety muscle of the tongue because it prevents it from falling backwards. So, its action is to protrude the tongue forwards. Okay. So, if it falls backwards, as you can see, it is going to compress your airway also. So, that is the safety muscle of your tongue, and if I lift this to the side, you can see the palatoglossal fold. It is coming from the palate towards the side of your tongue. This fold is known as the palatoglossal fold and it contains palatoglossous muscle. Okay. Thank you.